Welcome back to a special mini episode of Cancer Buzz. This podcast was created by the Association of Community Cancer Centers as a resource to help busy oncology professionals stay informed of the latest news and trends in cancer care. Today, we examine advocacy efforts for equitable access to genetic counseling. Our guest today says that while the role for genetic counselors in oncology is expanding, disparities in access to those counselors are widespread. Dr. Colleen Campbell is the Director of Genetic Counseling Operations at the University of Iowa, and she's currently serving as the Secretary-Treasurer of the National Society of Genetic Counselors. She pushes for state and federal legislation that would improve access to those services.
Genetic counseling and genetic testing are not the same. So genetic counseling is, I boil it down to patient education and advocacy. So, talking to an individual about what their concerns are, what they hope to get out of a session, what they hope to achieve. And sometimes that is genetic testing and how we can talk to patients about if genetic testing is appropriate for them. If so, which is the right test for them? And then the big part is interpreting those results and making it meaningful to the patient. I think the piece a lot of people forget about is the word counselor in our title. There's a lot of psychosocial issues that come along with being at risk for an inherited condition. And genetic counselors are really trained to help patients deal with those psychosocial factors. Genetic testing is being offered by everybody, and it can be offered by all sorts of healthcare providers. There is healthcare provider-initiated genetic testing, as well as the direct-to-consumer genetic testing. And the genetic test will just look at the specific DNA and then tell you if you're at risk for developing a condition or not.
Dr. Campbell, what are the major barriers to equitable access to genetic counseling across the board?
So I think the barriers overall for genetic counseling have dramatically decreased, but there's still a lot of room for improvement. And so what I mean by they've decreased is that the genetic counseling workforce is growing rapidly. And in September 2021, there were nearly 6,000 board-certified genetic counselors, which is up from 3,000 10 years ago. So the workforce is doubled in size. To be a certified genetic counselor, like I just mentioned, you have to successfully complete training in an accredited program and then sit for the American Board of Genetic Counseling board exam. When I say there's still room for improvement, we know there's room for improvement. And a recent study came out by Balache et al., and they demonstrated that there's really an uneven geographical distribution of genetic counselors across the nation. As you can imagine, many genetic counselors are located in urban areas. And so that means patients, especially those in rural areas, have to travel a great distance in order to access a genetic counselor. And we see that same situation playing out here in Iowa, where most of our genetic counselors are in Iowa City and Des Moines, and then patients have to travel to those places in order to get these services. That leads to the barriers, and we can either increase the number of genetic counselors and try to put more genetic counselors in urban areas. The problem with that is a lot of hospitals will call me frequently and say, we know we need to offer these services. We want to offer these services, but we don't know how to pay for the genetic counselors if they're not billing and being reimbursed. And so we either need to improve our billing and reimbursement model, or we need to be able to offer more telehealth services, which also go along with need to be able to be billable and reimbursed services as well. So I think there are access barriers, but it's really geographical at this point.
There's proposed federal legislation on Capitol Hill. What would that do to get over some of these barriers?
Yeah, so the proposed federal legislation is the Access to Genetic Counseling Services Act. There's a bill in the House, H.R. 2144, and a bill in the Senate, S. 1450. And what this legislation will do is really improve patient access to genetic counseling services. So it'll modernize Medicare by providing Medicare provider status to genetic counselors and allowing their services to be delivered to Medicare beneficiaries. Today, other providers are able to provide genetic counseling and get reimbursed for it, but genetic counselors are not. And there's actually incident to billing rules where another healthcare provider has to see the patient face-to-face and then make a referral to genetic counseling. This bill would remove that. So it would remove one of those extra barriers for patients to access a genetic counselor and allow Medicare beneficiaries to go directly to a genetic counselor. It'll also ensure the quality of the genetic services. So like anything new, there's a lot of people who want to jump on that bandwagon. but this bill would ensure that genetic counselors who have that genetics training at a graduate level would be able to provide high quality genetic services. And then it'll also improve reimbursement, which I think is really important for the access. So the bill will allow payment of genetic counselors at 85% of the physician's fee schedule. And this will allow genetic counselors to also be reimbursed for telehealth services. So I think it'll help hospitals be able to hire more genetic counselors, which will improve that access issue, as well as the telehealth. It'll improve the patient access for telehealth services.
So that's the federal level. What are you doing specifically on the state level with the Iowa Oncology Society?
Yeah, so the Iowa Oncology Society, in collaboration with the Association of Community Cancer Centers, is piloting a project in Iowa focused specifically on genetic counseling this year. And so the first thing they did is they formed a multidisciplinary stakeholder consortium to discuss and address what are the patient barriers, specifically in the oncology space, for genetic counseling, genetic testing, and screening patients who have cancer for hereditary cancer conditions, as well as their family members. So the consortium has specific work group discussions. And the goal of all these is to really identify what are additional policy, advocacy, and research-based strategies that'll enable us to better be able to have better access for genetic counselors by oncologists and patients in Iowa. And at the end, they're going to publish a white paper so that hopefully others can benefit from this experience. And I'm sure there'll be a lot of action items in there with other policy items that we can be working on that are specific to the state.
You can check the show notes for more resources on the topics discussed today. Next week on Cancer Buzz, advocacy efforts underway for coverage of biomarker testing. Until then, for the Cancer Buzz team, this is Summer Johnson.
This episode was supported by the Iowa Oncology Society, a chapter member of the Association of Community Cancer Centers.